ongoing. And we are soon to commence the next piece of road is the Willis Constantine Road. This evening, there's going to be a community meeting with residents to update them on the mobilization, the work to be done, and also to get their support and cooperation. For example, in cases where persons may have to move vehicles, may have to move things for work to be done. Also, contractors will be looking for a place to set up the site office and other important things that are critical towards logistics for the implementation of work on the Willis Constantine area. So we just want to give this important update as these routes are being implemented. Another important project which we have mentioned and updated the public on several occasions that has to do with the St. David's Fire Department. So we're happy to announce that a contract has been issued for that project, and that project will be commenced very soon, within a matter of weeks, for a duration of 8 months in St. David's. And this is a critical project for the community and the country as a whole, as we seek to increase our fire response operations throughout the country. And so areas where we have gaps, we try to strengthen those. And this is one of those areas with the space between St. George's and Grenville. This will allow for a better fire response for persons in the immediate St. David's area. Another important project that we just recently commenced is a retaining wall in the Mungie area, just opposite Hubbard's car area, automotive showroom area. This is an area that has been damaged for quite some time, and the road has been going away close to the river, at the close to the river bank, has been eroding significantly. So that retaining wall is commenced for repair to secure that. That is one of the important things, is that to ensure that doesn't create another challenge for us in terms of disturbance on one of our main roadways. We asking residents, commuters, to continue to cooperate with us as we implement this important road safety project. The St. George Vendors Market. We're happy to announce that the work that we were ongoing is completed, and 60 vendors are going to benefit from that new building that was recently completed. However, we have some other work to do as well, which we indicated. This is one phase. We have some other work to be done. So consultation is ongoing with the vendors, the stakeholders, as we prepare to hand over this facility. There are some other works like the washroom and another vendor building to be constructed. So this is a good development for vendors. One of the things that we must inform the public, we still are very much challenged with space for vendors. We continue to work to see how we can address this. We have a number of persons who vend full-time, and increasingly more on weekends, persons who come and do vending, who have other engagements but come on weekends to do vending. So we are going to work with everyone to create a space comfortable so that everyone can ply their trade as safely as possible in the best interest for themselves and the customers. Just a quick update on the St. John's River. Today we're having a site meeting with the contractor and consultant as they continue to prepare for the rollout of this important flood mitigation project. Mount Hartman work will commence Monday on the Mount Hartman roadway to pave the roadway. That area has been an area of great distress for residents within that area, and we at the ministry, of course, we are very happy, and the parliamentary rep, who is right here, I know he's very happy to have that road paved finally. And we have been getting some good calls and cooperation from the residents. I want to commend the residents in the Mount Hartman area for being patient and working along with us. We started with the drains work first, and now we are going to pave the entire roadway so that the issue of flooding and mud and persons cannot come out during the rain time, that will be something of the past. So we are very happy about that. We have a number of other concrete works being done, some of the inroads, some of the community roads being done, several. What we will do we'll provide an opportunity to give a general update on all those roads going forward at another particular time. It's quite a bit of roads that we are doing, and so I think it's important that we update the public on that as well. The Monkuma Road, it's out for tender, and we should receive bids for that on the 6th of August, and then works will commence soon thereafter. That is a critical road. I need not say too much more on that road. Every commuter, the ministry, persons in the north of the island understand the importance of this road for heavy vehicular traffic going forward in the future. The debushing program. The debushing program, as you know, is a very important program for the country, for the ministry, and it serves two critical purposes. The first one has to do with, and most important, the road safety. The debushing program is geared towards clearing our roadways, ensuring that it is safe for commuters, pedestrians to traverse on a daily basis. And as such, we are happy to indicate that this program will commence on Monday the 26th. The second objective of this program is to help engage persons to create significant livelihoods for persons, especially in our rural communities, through this important program. The program will commence on Monday and continue straight throughout December. There will be no break in the program, and we welcome this. The government and of course the cabinet felt that this is very significant for us to do at this point in time. As you know, each and every one of us, we are challenged in different ways from the negative impact of COVID. And it is, no one is spared the wrath of COVID. In some way, each and every one of our lives are impacted. And of course, every opportunity that we as government get to increase livelihood opportunities for persons during this period, we are going to do that. And through this program, we believe that it is important that we extend the program as long as we can to ensure that persons are engaged for a longer period to help them through this difficult time. And so we are happy to announce that the program will go from now until mid-December. Over 3,000 persons will be engaged through the program over this period, and that is something that we are very happy about. Moving a little bit on the transport side, there's just one more matter that I want to raise. It has been a matter of concern for the public. We as a ministry, we are very responsive, we are very sensitive to the challenges of our citizens and of course our stakeholders. And one of those issues that have been a major challenge for commuters, everybody, on a daily basis, and that has to do with the presence of derelict vehicles along our roadways. We have been in constant discussion with the RGPF, who is our strategic partner in this regard and a key stakeholder. And of course, the Minister for Health, who is here also, is the competent authority to help drive that process. We have looked at it, and we continue to prepare to take action very soon. I do not want to preempt the police, but I think it's important that I give some pertinent information, and the police, RGPF, the traffic department will give more information as we continue to roll this program out. There are some critical elements that have been hindering the response for traffic, and one of those being the lack of an appropriate tow truck to move the necessary vehicles off the roadway. So we have taken a decision to procure a new truck for the traffic department, and that has commenced. I don't have the lead time on when the vehicle will be here, but that is not as significant as what we intend to do within the coming weeks. We will commence the program even before having the tow truck in hand. We do have private service operators on island, and we'll seek to engage them to provide some support for us to commence this important program. So we just want to give persons who may be impacted a heads up to you can go ahead and commence to move the vehicle yourself, but we will have to take action to ensure that the road remains safe in that regard going forward. So these are the main updates I want to bring to the nation at this point in time. But I avail myself for questions for any other important matters that our media personnel who are online may wish to raise or gain some clarity on, even from what I reported. Thank you very much.
Thank you very much, Minister Cox. Very active ministry, but we did say that it is through infrastructure development projects that the country would recover and emerge out of this pandemic. So obviously government is fulfilling its mandate in that regard. Minister, before we turn over to Minister Steele, I just wanted to ensure that Carriacou and PT Martinique feels a part of the conversation. I know there is tremendous work being done there with road projects as well. I know you said a detailed update would come on roads, but I just wanted to bring them into the conversation a bit and then assure the nation that work is also being done on the sister islands.
Sure. Thank you very much for that. As I did mention, we have the Cherry Hill roadway, which is part of feeder roads. And also currently we are going to do a significant road, which is the Limle Road. I think it is out for tender currently, so persons are looking forward to that. It's a significant roadway. It's about 1 kilometer or so in length, so persons will look forward to participating in that. We do have the Carriacou airstrip, the lengthening of the airstrip, to go out for tender very soon. Work is just finalizing on that as well. I didn't want to mention too much about that, but we also have work. There is going to be the demolishing of the old ministerial complex as we seek to commence to finally construct a ministerial complex in Carriacou where all the services can be provided at one central location for the ease of business and more efficient operations of the Ministry of Carriacou and PD Martinique Affairs. So those are some of the major updates. As I say, we can do a special on Carriacou whenever going forward. But I know the Minister for Carriacou and PD Martinique Affairs, she's on top of everything, and maybe we can have her to come at PostCab to do a presentation on Carriacou in a separate setting. Thank you.
Thank you very much, Minister. Minister Steele, over to you for an update from the Ministry of Health. What do you have for us this morning?
Good morning to you, and good morning, Nolan, and all of our viewers and listeners out there. This morning, I'm giving you a general update. We unfortunately have 2 active cases in quarantine, though. Nonetheless, there are 2 active cases on island. Let me repeat, they are in quarantine at this present time. No symptoms. They're both travel-related persons who recently came into Grenada. We have given to date 20,866 first doses and 15,382 second doses as of yesterday. I want to say that at present, there are 605 persons in quarantine. That's a significant increase. We're at one of our highest levels in terms of number of persons in quarantine, the travel-related quarantine. Also to say that globally, which is going to lead me to my next subject, globally, 3.5 billion with a B doses of COVID-19 vaccines have been given. 3.5 billion. What we are seeing is a disturbing trend, but an expected trend, especially in the US now, and you can fact check on your own. Check any of the news networks, CNN, NBC, ABC, CBS, any of the local news. Call a friend up in the US. 98% of the deaths in the United States now from COVID-19 are unvaccinated persons. Let me repeat. 98% of the persons dying in the US now from COVID-19 are unvaccinated persons. We're seeing similar figures worldwide. Persons who are dying from COVID-19 are unvaccinated persons. As such, again, we're pleading with individuals who have not been vaccinated as yet to please do not wait until it is too late, to please come forward and take the vaccine. We continue to have our team available for any questions, any concerns, and to facilitate anyone who has finally decided to take the necessary steps to protect themselves. I've heard many persons giving comments, unvaccinated persons giving comments that the medications work. Why should I take the vaccine? Well, let me say that yes, the ventilators work when they shove that tube down your throat. It works to help your lungs do what it can no longer do. The defibrillator works as well when your heart stops beating to try and start it again. The medications that the doctors will use will work as best as possible as long as it's not too late. That's why people are dying from COVID-19. To have that sort of rationale is to say as well that surgery works. When they have to remove a part, then take no precautions. When you break a limb, a cast works for you to heal, but it takes a long time and it's painful and has a lot of inconvenience. But we still wear a seatbelt to protect us as best as possible so that if, God forbid, we were to get into a vehicular accident, we don't have many broken limbs, minimum. So I'm saying I cannot understand individuals who will not take the precautions to prevent them getting to the hospital and somehow find comfort in the fact that if and when they were to get to the hospital, that there are medications that have worked with other people in the world, so they will take their chance with that. I think it is unfair and unreasonable to place that burden on our medical team at the General Hospital. The fact is that, like any other country, we have been proactive and we have boosted our ability to deal with COVID-19. But like any other country, there is no amount of preparation that will get us past. If we were to have an outbreak and a significant number of our population not vaccinated would end up in the hospital and we would be inundated. We could build 1,000 more rooms. We still would be inundated. We are limited by the resources we have, the number of doctors, the number of nurses, and the facilities that we have. We have boosted those facilities to the best of our abilities. Percentage-wise per population, we are more prepared than the US, percentage-wise per population. But I guarantee you, like the US, like the UK, like Europe, if COVID-19 does breach our borders, or when COVID-19 breaches our borders, we will be inundated and many persons will die. We're trying to prevent that. That's why we're asking you, please come forward and take the vaccines that have been available to the population since February of this year, the middle of February of this year. We have had much more vaccines than any of the demands thus far. In fact, we've had the ability to lend some of our neighboring countries whose populations have been coming forward in greater percentages than our population has been. And I want to my final statement also to say that we have all seen the increase in activities over the weekends of individuals taking it upon themselves to defy the regulations, to defy law enforcement, and to come out and play jab. It is a time of year where we normally would celebrate that. We are in a pandemic. We are at high risk. And as such, I'm pleading with individuals to please have common sense prevail. That we need to take the necessary precautions. And I want to clearly state, because I've heard some individuals saying that the Ministry of Health or the Royal Grenada Police Force have given permission for some of those activities. That is not the case. No Juve type, no jab type activity has been given permission at all. And therefore, we're asking our law-abiding citizens and all of our Grenadians to please think twice. No one in the US or in Trinidad in British Virgin Islands, in St. Kitts, no one went out with the expectation of getting COVID. Nobody said, I'm going out today to get COVID. Everybody thought they were either invincible or they were safe or they were going to take the necessary precautions, or more importantly, threw caution to the wind. If we continue to throw caution to the wind, we cannot expect to have any other result different from what we're seeing in our other Caribbean islands. We are one Caribbean people, we're one Caribbean culture, and it appears, based on our own actions, we would be doing this to ourselves. We are also going to go down the one Caribbean COVID history, that we will all succumb. All I can do and all the Ministry of Health can do is to plead with individuals. Follow the regulations, take the vaccine, help to keep us all safe. And apart from that, the only other thing we can do is wait. Wait for the inevitable and hope that we're able to deal with each and every one of you as best as possible. Thank you.
Thank you very much, Minister Steele. Very sobering message. And for me personally, looking at what is happening in the British Virgin Islands, where I lived a few short years ago, I mean, the number of deaths that have occurred in recent days, quite a few people that I know, and the numbers have risen dramatically. It creates this sense of apprehension as to when that shoe will drop, for Grenada. And I think it really underscores the need for us to do all that we can at this point in time so that we avoid the situation that we are seeing across many of the islands. So, ladies and gentlemen of the media, we have had the introductory comments from the Ministers of Health and Infrastructure Development. The time is now for you to ask your questions. Are there any questions yet? I see that we have GBN, MTV, Nancy Maguire from the Grenadian Voice, Callistra Faria. Anyone with questions yet? Okay, I see MTV with a hand up. MTV, you may proceed with your question. Good morning to you.
Good morning. My first question is to Minister Nicholas Steele. The government keeps reiterating that the vaccine is not mandatory. However, in recent weeks, we've seen businesses sending home workers due to their failure to accede to the demands of forced vaccination. At what point, if ever, will the government or can the government intervene on the behalf of these workers?
I'm not aware of any forced vaccination occurring in Grenada. I am aware of public citizens and private entities exercising their right to keep their workplace as safe as possible. In fact, I would go further to say that those institutions that are not are making every effort to keep their workplace and their workers as safe as possible, they need to consider whether they will be liable for any employee who contracts COVID-19 on the job site when they have not done everything possible to make sure that all of their employees are as safe as possible, which means vaccinated. It goes both ways. It goes both ways. And I think any responsible employer needs to consider whether he or she is culpable if they do not ensure their workplace is as safe as possible. The same way to make sure that persons maintain social distancing, that persons entering the work site are wearing masks, that the work site is sanitized properly. I think now, knowing that vaccines have been available is something that every employer needs to take into consideration. We can only plead and beg the population to please take the necessary steps. It is not mandatory vaccine, but I applaud those establishments that have been proactive enough to make sure that their workplace is as safe as possible from a COVID-19 pandemic.
If you just permit, I too want to support Minister's comment by saying, let's look at it from a practical standpoint. Now, a business owner say fine, persons can come to work, you don't have to be vaccinated. One person, an employee contracts the COVID, what happens thereafter? The entire business would now have to shut down. All employees will have to be isolated, tested, and if more than one persons are infected, quarantined. Now, what does that say? It says that each and every employee, including the person who failed to get themselves vaccinated, are going to be impacted negatively. So the effort of business persons is not one not just thinking of a situation where you're just forcing somebody to get vaccine. They're looking to protect lives and livelihoods of employees and for themselves. I think it's a common sense approach. And so I think that is what they're asking persons. Put yourself in each person's shoe, the business person and the other employee, other colleagues who are also trying to make a livelihood for themselves and their families. So I think I just want to put that on the table as well.
I think we need to also find a balance between the right to a job and the right to a safe work site. I firmly believe the right to a safe work site and the right to life comes first and foremost, and that no employer should be allowing or forcing individuals to come to work without making sure that the necessary precautions exist at the work site. So for the vaccinated persons, they have a right to have a fully vaccinated work site. For the vaccinated customers, they have a right to have a fully vaccinated establishment to go to because they have taken the necessary steps to keep themselves and their families safe. And I think we all need to make sure that there are places around that we can go, that we can frequent, that we can feel safe at, all of us. And I think that comes first and foremost. Life and health is first.
Thank you, ministers. We have another question from MTV. You may proceed.
Thank you. My question is for Senator Cox. First question, has the government come to any conclusions on concessions or so due to the high fuel costs for bus operators? And the second question is, can you break down how the government tax operates on fuel?
Thank you very much for your question. As regards to your second part of the question, in terms of the cost breakdown for fuel, I'm unable to give that at this point in time. So my apologies for that. For fear of me giving wrong information, I would not attempt to do so. On the part of concessions for the bus operators, we have been having some extensive discussions with the bus operators, in particular the omnibus sector. We recognize that they do have some unique challenges as regards to the operation in terms of the cost of operations. We have provided support to the sector since the commencement of COVID in significant ways, and they are very appreciative of it, and they have registered that as well. We are continued having those discussions. We have also presented them with some other relief measures, separate and apart from concessions on fuel per se, as that is something that the Ministry of Finance will have to look at, do the analysis to see whatever concessions that they can afford, and if so, how that will impact on government's revenue at this point in time as well. As you know, there is a direct correlation to what revenue government collects and on what services it can provide and how we can meet its recurrent expenditure on a monthly basis. So that is a challenge in that regard. However, the Ministry of Finance, with support from the Caribbean Development Bank, we are currently working on a COVID-19 relief support to provide support not only to the omnibus sector, but also small businesses. And that support is in the form of a very soft loan, extremely soft, and I'll give some of the measures, coupled together with a grant. So it's a two-part initiative. Soft in the sense that persons can access that, and we did indicate to them that some of the persons who have challenges, who would have taken a moratorium from their lending institutions and are now faced with extra charges, that they can borrow such monies to pay out those interest charges that they incurred at a repayment rate of just I think 1.5%, and they have 3 years grace period to start to repay. The final details as to how much they can access is still being worked out, because as we indicated, it's not only just for the transportation sector, but it will be for all businesses. I'm just giving some preliminary indication as to that particular support, but the Ministry of Finance and the Minister of Finance will do something very detailed going forward once that is finalized. But we are reaching out to them to provide some support for them. Just imagine if you have a particular loan right now, let's say maybe $5,000, $10,000 on your bus, you can access this soft facility, pay that off, and you have 3 years grace period to recover, and then you repay at a 1.5%. So that is what we are offering right now. That's what we're working on, and all the other measures we are working on it as well. They have asked us to put a halt on the of adding new buses into the sector, so as to minimize the competitiveness. Cabinet, at the same time, coincidentally, we are working on a market study with support from the Caribbean Development Bank, and that coincide with their requests for a moratorium, and Cabinet have decided to accede to such. We are looking towards commencing with the moratorium from the 1st of August. However, that will be finalized when all the details with our key stakeholders, like, for example, our car dealership who may have buses on order and things like that. So we are very sensitive to that. So once we finalize all those details, there will be a moratorium and adding new buses into the sector. So those are the support that we are currently offering them. But as regards to support on the fuel end, discussions are still ongoing in that regard. As I indicate, we are very sensitive to the challenges that they are facing, both the taxi and the bus operators. We continue to remain in constant engagement with them. We have asked them to even provide information on some of the members who are directly impacted in some cases. I know that some buses were repossessed. So we are trying to gather all that information to see whatever support that we can give to them at this point in time. We know it's a tough time for everyone, as I indicated earlier. The entire sector, the entire country is negatively impacted from COVID at this point in time. Thank you.
Minister, just to follow up on that, in terms of the moratorium, is there a particular duration of that moratorium? Has that been decided yet?
It will be for 6 months. Once we finalize on the commencement date, it will be for 6 months to allow for the market study, so that once no more buses have been added, they can do a study of the sector to look to see what are some in terms of regulations, in terms of policies, operations, licensing, to help the omnibus sector, to help improve their operations. That is what we believe that the time is now for us to look at it as the sector continues to grow. So that is a critical activity for us to help us strengthen the transportation sector as we move forward.
Thank you, Minister. Nancy Maguire, you're next. Good morning to you.
Good morning. For Minister Steele, I was wondering the status of this COVID-19 vaccination ID, photo ID you had mentioned a while back. And also, when this whole thing started with COVID, you had said initially that the ministry was in discussions with different vaccine manufacturers. I'm just wondering if that is still the case, or are you just solely depending on the COVAX? Because I see there in some of the neighboring islands, they do have other varieties than the AstraZeneca. So I'm just wondering where we're at with that. And for Senator Cox, I checked in at Agriculture Feeder Road, so I don't know if I missed something before that, but I need to ask you where we're at with the traffic lights, because you had said, I think it was around the middle of June, it'd be a couple of weeks before there's action. And I wondered, too, if you've had a chance yet to see the design of the Grenville Commercial Complex. Thank you both.
Nancy, thank you for your question. I know last week there was a trial run on the electronic version of the vaccine ID. The site went up for a while, and individuals, quite a lot of individuals, accessed it to check, and so. And I'm hoping that it will be permanently up this week. We are seeing some issues where individuals, when they came for their second dose, the name was spelled differently, or middle initial was used as opposed to middle name or so, and that has created some issues with the system. So it is very possible that individuals, when they're checking, they may only see one dose. What that means is based on the way they have put their name on, that the system is picking up one version of that, and that they would just need to come in, verify with the ministry, so that we can make the adjustments as to whether it was a spelling error in entering their names, leaving out the middle initial, or an error with the date of birth or so. So we're encouraging people to do that once the site is back up. It should be back up, if not today, by tomorrow for the electronic version, and we're hoping by the end of this week to begin a trial on the actual vaccine hard ID, picture ID, as well, which will be accessible for individuals who would like that. With respect to the variety of vaccines, yes, we have been consistently in communication with other vaccine manufacturers. We have been doing so through COVAX as well as individually. We have secured and would expect delivery of some of those other vaccines imminently. But as always, I'm not counting a single vaccine until it is on island. So once a WHO-approved vaccine is accessible on the way or on island, we will announce that it is. At present, the only vaccine that is on island is the AstraZeneca. We have been in discussions and are looking at Sinopharm, as well as the entire Caribbean region has been in discussions with the U.S., hopefully to access Pfizer. Once we know something concrete, we will announce. I have heard many people saying that they will wait for X vaccine or Y vaccine. Most of them are ignoring the fact that the best vaccine is the vaccine that's here. Waiting for a vaccine, whether it is waiting to take the vaccine that is here or waiting for another vaccine to show up, is extremely risky. It is throwing caution to the wind. In the countries that there are other vaccines available, individuals don't have the choice as to which vaccine. It's just simply that one distribution point will have a certain vaccine based on this area, and you can ask friends and family in Trinidad if you wish. You don't get to choose which one. Right now, you may say, uninformed, that Trinidad has AstraZeneca and Sinopharm. No. Trinidad has used up all of his AstraZeneca. It is now using Sinopharm. Persons don't have a choice, because persons are rushing to protect their lives and would like to take a vaccine now after hesitating until it is too late. We don't want that situation here.
Sure, go ahead, Minister.
Yes. Let me start with, thank you very much for your questions, Nancy, as usual. Let me start with your last question first, whether or not I had sight of the design for the Unfortunately, no, I have not seen the final designs for the Grenville Commercial Complex, but I do know that it is currently out for tender. As soon as a final contractor, a preferred bidder is selected, I may have sight of it then. If there is a particular reason or follow-up question or something regarding it, the design also, you can always ask. We do not have any challenges in that regard. We're providing support. As regards to the traffic lights, the traffic lights is moving. The project has commenced. The contractor was on island for a number of weeks, I think for about a month or so, doing the groundwork. As you know, this project is an equipment-intensive project. As such, they would have to do a lot of procurement in initial stages and then installation thereafter. So they have been doing a number of surveys, underground surveys, discussions with key stakeholders like the RGPF, and just finalizing some of the issues, finalizing what are some of the features that we would want, like, for example, the issue of red light camera. So if somebody were to run a red light, a camera would automatically snap your number plate, capture you inside the vehicle, and your ticket will come in the mail or something like that. So those are some of the things that we are just finalizing on currently. So yes, the project is ongoing. We are hoping to see, because procurement, they will have to be manufactured. Manufacture will take a couple of months. So we are hoping to see actual installation sometime in probably in February, I believe, from the last report that I had. But the project is ongoing. Thank you.
Minister, just to follow up on that, in terms of the funding for that particular project, the questions keep coming. Can you identify for us the source of funds for the traffic lights project?
As I did indicate it previously, and persons can verify that by checking with a copy of the revenue of expenditure, estimates and expenditure for 2021. It's a grant project, and it's not from local revenue. So I just want to reiterate it again. Thank you very much for that, Philo.
Thank you, Minister. I get the questions all the time, so I just want your help in stating it publicly. Do we have any further questions from members of the media? I don't see a hand up or any acknowledgement in the chat, but we still have GBN, MTV, Nancy Maguire, and Callistra Faria in the conversation. Any questions from any of the journalists?
Good morning, Christelina John here, GBN.
Good morning, Christelina. Please go ahead.
I have questions for both Senator Cox and Minister Steele. Senator Cox, in terms of the completion of the market project, how would the determination be made as to which vendor, who gets a booth, and the payment? Would they be charged a fee at the end of every month that they would have to pay, like a rental fee for occupying the space? And for Minister Steele, any consideration being given to a digital passport based on conversations I've heard and moves that I've seen by other countries to adopt such? Can you comment on this? And two, what would be the purpose of the vaccine ID? Thanks much.
So I think I'll bat first. Thank you very much, Christelina, for your questions as usual. Let me start with the easiest one first, which is the fee. Yes, there is a fee structure in place for persons using the booth. I don't know the amount that is the rate currently, but I do know that there are significant outstandings that I'm aware of, and we want to implore on persons who continue to use the facility to meet their commitments in paying, because those fees, I believe, is minimal. But I know some of those fees are long outstanding, so that is something that we are trying to rectify and regulate going forward. As regards to the selection process, and that is where one of our biggest challenges, and we have had significant discussion on that aspect in terms of selecting vendors. There are a number of persons who are displaced, and of course they would be given some top priority. But what would be most critical in terms of the selection it will be based on the type of vending one is actually engaging. So there are persons who do dry goods, there are persons who do vegetables, ground provision. So those booths, they're designed for specific vending types. So that will take into consideration for the selection process. So those are some of the criteria that we'll be looking at. There are persons who are displaced at the stadium as well. So all those discussions are taking place. And the final selection, it will be one that definitely will bear significant consideration in terms of fairness to ensure that there is smooth operations at the market. We are very concerned about that. As we indicate that we have other booths to also construct and renovate, and the work is ongoing. So persons who would not be selected now would get an opportunity going forward. Also, based on the type of vending, that will inform what type of booths we build for the next project as well. So we are finalizing those details as currently. So persons will indicate. So they would know whether or not there will be selection in this process or the next one based on the type of vending that they do. So thank you very much for that question.
And to answer your question, what we trialed and the question that was asked earlier about the vaccine ID, that is a digital ID. So persons can go online, they will get an electronic version of their vaccination card or vaccination ID. So we are waiting on the European Union version, the British NHS version, and some version out of the US so that we can have the portability. They don't have theirs as yet. We have organized our vaccine digital ID that is accessible to persons. As I said, there were some issues with respect to the spelling of names, etc., that persons couldn't find or would only find one dose when they did take 2 doses because of how it was recorded. The second dose was recorded. And the reason for it, it's giving 2 versions, the fully electronic version that persons can keep on their phone or print out on a piece of paper, and a ID style similar to your driver's license, same size for portability and integrity. Either system is linked to what is called a QR code that allows anybody anywhere in the world to verify the validity of it. In scanning the QR code, it immediately queries our database and will verify the information that is on the card, so a person can't fake the information.
Thank you, Minister Steele. I don't see any further questions. Christelina, you have a question? I'm sorry.
Yes, I do have a follow-up for both. Mr. Cox, you said that for the people who would not, say, get accepted in, say, the first batch, if we want to call it that, of 60, there would be allowances going forward. In the meantime, what arrangements are being made for the rest of these vendors who would not be occupying that space for now? And for Minister Steele, I'd ask the question, then what would be the purpose of the ID? When, okay, that you do have it in hand or electronically, what would be the purpose of someone having such a card?
Thank you very much, Christine, for your question. What I can tell you, I think it's important for the public to know that even after we finish with renovating all the booths and putting additional spaces, vending booths in the market, it would be insufficient for all our vendors. And that is the fact that we are contending with. So we have been having discussions with the traffic department to looking at going back at utilizing the Granby Street during the Friday and Saturday period. So we may see a return of that to accommodate persons, the increase in vending on the weekends. But we really and truly want to work towards removing persons on the side of the street. We believe that once we prepare the market as properly as possible as we can, so the person can operate within the context of the market, that is what we're striving to achieve. But we would allow to use the street, the Granby Street, for vendors on the weekends in particular. So those are the dynamics that we are playing around with right now. But the biggest challenge is that the market cannot accommodate all the vendors, even when we're finished completing all the renovation works and additional booths or so. That is the challenge that we are having currently. And there have been a discussion from various circles, or there are persons who do different things within the market, not vending, but may have small shops, maybe some hair salon, boutiques, whatsoever. Those things happen sometime back, and persons are saying, look, oh, we should move those persons out, have it only exclusively for vending. So those are the intricacies and the sensitivities of it. Some of it is difficult to reverse right now, but the challenge is space. We do not have enough space to accommodate all our vendors. But they have been working with us. I must commend them for that. They have been working with us, and they understand the challenge before us. And we are going to find the best suitable configuration so that everybody would be comfortable, so they can apply their livelihood. Thank you very much for the question.
The reason for the ID is portability and durability and integrity. Right now, we give individuals a vaccine card. We have also facilitated at some of the sites to make the vaccine card a little more durable by laminating it. But it is still a fairly large paper. So the reason for going with an electronic version and or a driver's license style version, durability, portability, integrity, and individuals need to be carrying their vaccine ID or vaccine verification for travel purposes, for fully vaccinated events, and for certain establishments now that are saying only fully vaccinated people will enter. So we need to be able to facilitate that. And I know that there are many people out there that proudly want to carry their vaccine ID driver style or electronic version to show that they have taken the necessary steps to protect themselves and their family.
Thank you very much, Minister. We have 5 minutes now before 11, but Nancy, I did see that you have a follow-up question. You may proceed, and then we go right into the wrap-up. Nancy?
Good morning again. I meant to ask if the Minister of Health, whether the cases that we have are being tested for these new variants. And also for Minister Cox, what is the status of the management of the Grenville bus terminal? Is it in the hands of the Port Authority yet? And also, I'm still not clear on these photo IDs. When you say you can go online, you can get a digital version, you do that through the Ministry of Health, and then where would you go to get this photo ID if it happens? Thank you again.
Thank you very much for your question, Nancy. As regards to the vendors, the bus terminus, in Grenville, yes, the bus terminus is still under the responsibility of the Ministry of Infrastructure. We are currently doing preparing for some renovation works. Discussions are ongoing with the Greater Ports Authority in that regard. But that will be finalized sometime thereafter. We have two major challenges at the bus terminus that we are trying to rectify. One has to do with some issue of flooding, and the engineers I personally had an opportunity to be on site and have an in-depth discussion to see how we can address that. So they are designing some drainage works to treat with that response. And the second one had to do with some work to some fixtures to be replaced that can withstand the proximity to the shoreline, so can stand the sea blast. So things like the hinges, the locks, the windows. So those changes are currently being done to the boots, so the boots can be handed out thereafter. I know that the selection process for the boots, I think it has already commenced or completed, and once that is done, once we finish those remedial works, we will see some formal process taking place, some formal activity taking place to formally commence the bus terminus. It has been some time. But we are on target to see how we can get this rectified once and for all. Thank you.
And Nancy, the website that will be released officially later this week will allow individuals to go to the website, enter their name and date of birth, and they can also an optional entering of ID, because there's been many variations with the type of ID that individuals use, and we found many times individuals came with one ID for their first dose and another ID for their second dose. So name and date of birth, it will give you access to your electronic vaccine ID, which will be your name, the dates of your dose, and a QR code. If individuals want, and that can be printed or saved on your phone as an image to show when you are traveling or when you are entering establishments that wish to verify whether it is a doctor's office, whether it is St. George's University or wherever else, or your place of employment. There is the other version that we hope to launch with later on this week or next week, which would be a hard copy, which would look like a driver's license, but will have your picture as well there. So if you are taking the electronic version, the first version, you would still have to walk with a picture ID to verify name that it is you. If you took the picture ID hard copy version, it would be the only form of ID that you would need for entry or proof or verification. So those are the two versions. Like other countries, we are tweaking them. No other country has it out as yet, so to Grenada, but we are expecting this week to have it released and ready for access by the public. The trial released last week, did produce some concerns from people who couldn't find their second dose, as I said, because of spelling errors or things like that. We tried to clean up as best as possible, but the only way forward is to, I think, release and have persons who have any issues or so, they contact us or come in and make the changes or adjustments for them. So that is the ID process. In terms of variants, yes, we have been testing for the variants. The last 3 cases, the first of 3 was tested, and the variant identified, it was a variant, the Alpha variant, which is better known as the UK variant. And the other 2 recent cases, the results are pending. We expect those results, I'm hoping, by the end of this week from CARPHA for us to be able to verify. We have the ability on island as well. The process does take some time to identify the variants. It is a matter of time before we do find one of the more deadly variants, and hopefully we will be able to have that individual in quarantine and maintained in quarantine. But as you are very much aware, those variants are less forgiving, and any breach or any interaction with unvaccinated persons by somebody who's positive with one of those variants puts us all at risk.
Thank you, Minister. While you have the floor, I'll just ask you to give your closing comments, because we're at that time where we are ready to put a wrap on this morning's press briefing.
Yes, well, thank you. Let me end the way I started, in terms of saying that 98% of the cases that are being hospitalized and dying in the world are unvaccinated. We have the ability to protect ourselves. We've had the ability to protect ourselves since February, and we're pleading with you to please come forward and take the necessary steps to protect you and your loved ones. All of us here in the room have already done that. We're asking you to do that as well, to keep you safe and to keep our economy moving forward. We have 2 active cases right now in quarantine. The case before that, as I just said, was the Alpha variant. We only need one of those individuals to interact with one of our unvaccinated persons at Morris Bishop International, a taxi driver taking them to their established quarantine site, a worker at the established quarantine site not being vaccinated. That's why we are pushing and making it mandatory, and have made it mandatory for the quarantine sites to be fully vaccinated. We need the taxi drivers at the airport and Morris Bishop International staff to be fully vaccinated. It has to be. Like I said, we only need one simple, minor chance interaction with an individual in the process of coming into Grenada or going to quarantine to interact with a member, an employee of Morris Bishop International who is not vaccinated. And then they interact with other family members or so. And that's all it took in St. Kitts. That's all it took in the BVI. And that's all it will take in Grenada. We would be no different. So we, again, calling on individuals to please come forward, take your vaccine. And finally, we continue our position that the events that we're seeing on weekends are reckless, are dangerous, are not within the law or the regulations, have not been given permission. The police are doing their best to maintain law and order, and I'm asking on the law-abiding citizens of Grenada to assist in complying. No organizer of any jab or Juve activity has been given permission. Anyone who says so, they are misleading you and trying to encourage you to break the laws and the regulations. Please take it upon yourself to keep yourself and your families safe. We have so many other stories of friends and families in St. Kitts, in Trinidad, in BVI, who went out never thinking that they would bring it home, and have been the cause of the death of their brother, their sister, their mother, their father, because they went out on a similar reckless event thinking we don't have it here, and not realizing how quickly it spreads and how quietly it can spread without the authorities knowing.
Thank you very much, Minister Steele. Minister Cox, your final thoughts this morning.
Thank you very much, Press Secretary. Just two things. I first want to start on the issue of our roadways. And I know that we have been receiving feedback in some cases of frustration from our commuters on a daily basis with some of the challenges of our roadways, and we have a responsibility to address those, and we are facing those challenges head on. We continue to do our maintenance work as quickly as possible as we can. We do have interruptions, weather-wise, even resource-wise, supplies-wise. We have breakdowns. We have little challenges here and there. And one of those challenges is because of the same issue with the Western Main Road. We have to traverse through Mount Morris. So those are some of the inherent challenges that we have, but not to so much burden the public with that, but just to say that we understand. We continue to empathize with you, and we are going to continue to do the maintenance work to keep our roadways as comfortable, as safe as possible on a daily basis. We are planning some significant work, some permanent responses. We'll hear more about that going forward, so I wouldn't go in detail on that. As soon as we have the schedules ready, I'll keep the public informed on that. So I'll definitely come back to give some update on that. We have had those discussions with our key stakeholders, so that persons would understand the intricacies of why we're doing this area and not that area. So we'll have those discussions going forward. But I just want to cite that because I know that the public, they are critical in how we dispense our service, and their feedback is very important for us, for our planning and for our investment into the sector as we move forward. I too want to close on the issue of vaccinations, and two from my ministry in terms of public utilities, telecommunications, and to make a clarion call to persons who are holders of license for radio stations, television stations, to be responsible in their presentations to the general public during this pandemic time. And I say this because sometimes we give our opinions, we use our opinions, and impose those opinions on the listening public who we have influence over and don't understand the gravity and significance of what our actions can do. I know of cases where key persons in communities would have been indicating don't get vaccine, this, that, and all sorts of stuff, trying to dissuade persons from being inoculated. And it's only until then that they had a family member who died from it, then the position changed. And they run and get vaccinated thereafter. And so I say this for persons who are taking that stand, to know that you have a responsibility. If you are taking a position to tell persons that they should not get vaccinated, if that person dies, remember that your advice, you have a responsibility in that person's consequence, whether being hospitalized or death. So I say this because people take it for granted. When you're in a position of influence, you have to be responsible, and you have to act responsible. And sometimes your personal opinion can be dangerous for people, can be dangerous for a nation, and so you have to consider that. I pay attention, and there are a number of influential sporting personnel and other persons in the world. When asked about vaccination, they said, "Look, this is a personal decision for me, and I wish not to share with the public," because they understand the gravity and the influence that they have on people, that if they say either one way or the other, how it can impact the lives of people. And so I just say this for what it's worth. I think it's very important for persons who are holders of those licenses, who have been granted with a responsibility to serve, to communicate to the nation, to do so in a responsible way. I don't know how much more we can say. Again, you know something, one of the amazing things about being a human being is that even while myself, Minister Steele, we are all vaccinated and have some degree of safety, we are very fearful and concerned about persons who are not. And in some cases, those persons, they are not even concerned about themselves. And it's just that level of compassion that we have as human beings, that is what continues to drive us as leaders and drive us as government to ensure that we continue to persist. And while it may look bleak, as if we're not going to achieve this, we might be frustrated in some case, but we are going to stay the course to ensure that we leave no stone unturned to ensure that we keep the people of Grenada, Carriacou, and Petite Martinique safe. So I just want to close on those words. Thank you.
Thank you very much, Minister Cox, and to you as well, Minister Steele, for your presence here this morning at this week's post-cabinet press briefing. Government certainly continues to delicately balance the protection of lives and livelihoods as we go through this pandemic. We have been fortunate thus far in Grenada, but as has been mentioned so many times here this morning and over several weeks, at the drop of a dime, overnight, things can change. We see what's happening elsewhere. So we just need to really do what we as individuals have a responsibility to do and help to ensure that Grenada does not experience what we see happening elsewhere. I am Press Secretary Philomena Robertson. Thank you so much to members of the media for joining us, to members of our listening and viewing audience. We'll see you again next week. Have a good week.